Mpox is spreading rapidly, and researchers are racing to find answers. The World Health Organization, WHO, recently declared a public health emergency for Mpox due to a concerning form of the virus spreading to multiple African countries, where it hadn't been seen before. This variant, known as Clade 1b, has since been detected in travelers returning to Sweden and Thailand from Africa. Although the current outbreak has been known since late last year, the urgency for understanding and addressing it has intensified. The Democratic Republic of the Congo, DRC, has long dealt with the Clade virus, to which Clade 1b belongs. Previously, Clade infections were mainly due to contact with wild animals, and outbreaks were usually contained. However, Clade 1b seems to be spreading primarily through human contact, including sexual transmission. This year, the DRC alone has reported nearly 18,000 Mpox cases, many in children, with at least 600 deaths. How does this emergency compare to the one declared in 2022 when Mpox spread globally? How is this virus different from the Clade 2 variant that caused that outbreak? Can Africa contain this new threat? Researchers are urgently seeking answers. Is Clade 1b more deadly than other strains? It's difficult to determine, according to Jason Kindrachuk, a virologist at the University of Manitoba in Canada. He explains that the DRC is experiencing two simultaneous outbreaks: the Clade virus, endemic in forested areas and transmitted from animals, and the newer Clade 1b. Although animal studies suggest Clade I is more lethal than Clade 2, its impact on humans remains unclear. Even without being fatal, Mpox can cause severe symptoms like fevers, aches, and painful, fluid-filled skin lesions. Although reports suggest a 10% fatality rate for Clade I, infectious disease specialist Laurens Liesenborgs from the Institute of Tropical Medicine in Belgium believes this figure may be overstated. Even the WHO's estimate of a 3.5% fatality rate in the DRC could be inflated. There are several reasons why fatality estimates might be inaccurate. Surveillance data often captures only the most severe cases, missing milder ones that go unreported. Additionally, secondary health conditions can skew fatality rates. For example, individuals with untreated HIV are more likely to die from Mpox, and malnutrition in children under 5 in rural DRC may contribute to higher death rates. Is Clade 1b more transmissible than other types? The Clade 1b virus is raising concerns because it seems to spread more easily between people than previous strains, including through sexual contact. Research posted on medRxiv suggests that Clade 1b has genetic mutations likely induced by the human immune system, implying it has circulated among humans for some time. Clade IA, which typically originates from animals, has fewer of these mutations. However, Liesenborgs points out that mutations and clades might not be the most critical factors in understanding Mpox transmission. The virus's spread could be more influenced by the population density and other conditions in the regions where it circulates. Clade IA is more common in sparsely populated rural areas, whereas Clade 1b is found in densely populated regions, where it spreads more rapidly. Jean Nichega, an infectious disease physician at the University of Pittsburgh, notes that many aspects of Mpox transmission are still unknown. Scientists have not yet identified the virus's animal reservoir, though rodents are a possibility. We have to be very humble, Nichega says. How effective are vaccines against the Clade I virus? Health experts are turning to vaccines to help control the Mpox outbreak, similar to the approach taken during the COVID-19 pandemic. Although there are no vaccines specifically designed for Mpox, vaccines for smallpox, Jynneos by Bavarian Nordic and LC16M8 by Kilometer Biologics, are believed to offer some protection. However, the effectiveness of these vaccines against Mpox, particularly Clade I, remains uncertain. Previous studies have only tested the vaccines against Clade 2 in mostly young, healthy men, who have sex with men during the 2022 outbreak. Research in the DRC found that the Jynneos vaccine could produce antibodies against Mpox in about 1,000 healthcare workers, but more data is needed. A team in the DRC is launching a clinical trial to test whether the Jynneos vaccine can prevent Mpox in people who have been exposed but are not yet symptomatic. Will the vaccines help control the latest outbreak? So far, Mpox vaccines have been scarce in Africa, but several wealthy countries have pledged doses to the DRC and other affected nations. The US has offered 50,000 doses of Jynneos, the EU has ordered 175,000 doses, and Japan has promised 3.5 million doses of LC16M8. However, none have been delivered yet due to the WHO's ongoing evaluation of their safety and effectiveness. Even once the vaccines arrive, Espoir Bwenj-Malambaka, an epidemiologist in the DRC, warns that they will only be a drop in the bucket. The African CDC estimates that 10 million doses are needed to control the outbreak. The uncertainty around vaccine availability complicates distribution planning, with vulnerable groups such as children and sex workers, whose profession is criminalized, being the focus of the distribution strategy. Researchers express frustration that vaccines and other resources were not made available earlier to prevent the spread of Clade, noting that the delay has made it more challenging to manage the outbreak. The opportunity was there a couple of months ago to cut this transmission chain, but resources weren't available, says Liesenborgs. Now it will be more challenging to tackle this outbreak, and the population at risk is much broader.
Thank you for tuning in. For the latest updates, don't forget to like and subscribe to our channel. Have a wonderful day.